L channel blocker. L means stands for long acting. Like amlodipine, it's a vasodilator. But it also has a little bit, not much, a little bit of T channel. But because it is a slow release acting and long duration, it has got a smooth effect on blood pressure and does not cause tachycardia like amlodipine. So azelnidipine is like amlodipine for blood pressure, but because of its pharmacology and binding to the membrane, it does not elicit reflex tachycardia. And it is effective and it is highly lipid soluble. And because of high lipid solubility, it does not cause reflex tachycardia. In the earlier studies, you look at the earlier studies, 2003, they have shown that azelnidipine, a very preliminary trial, in fact does reduce a BP. So one pharmacological principle has been satisfied, that it is an antihypertensive drug, causes so-called double-digit reductions in blood pressure. Then naturally, it has to be compared to the gold standard of calcium blockers, namely amlodipine. And if you look at the comparison between azelnidipine and amlodipine, a crossover trial, again from Japan, and this investigator sent me some data, you will notice efficacy is the same. You can't tell the difference. So one important thing is azelnidipine is as effective as amlodipine for blood pressure. And this is one more study, a little bit more recent one. I wanted to put a more recent one, again showing that azelnidipine and amlodipine efficacy is very similar. And they also compared with another calcium blocking drug used in cysture called nitrandipine. So it has been similar efficacy. One difference appears to be that azelnidipine has a modest reduction in the heart rate. It is because of its gradual onset and smooth duration of action is often associated with increased risk of cardiovascular complications. Whatever the reason, it could be blood pressure, it could be coagulation, it could be endothelial damage, doesn't matter. He looked at the morning to evening blood pressure, the sum. You will notice it was significantly reduced with azelnidipine, suggesting that it attenuated the morning rise in blood pressure. It aborted the morning rise in blood pressure. I have drawn a full circle, then I'm coming back now to the beginning. The end is going to join the beginning. So an ideal dihydropyridine CCB should be as effective as amlodipine. I think from the data we have seen that the azelnidipine is as effective as amlodipine. I have shown you the data mainly from Japan on the efficacy. It appears to be quite effective. It is well tolerated because of reduced incidence of ankle edema. And I showed you the study with combination therapy. It is less likely to cause proteinuria. I will never say it doesn't. So based upon published literature, there are almost 300 publications. I read 50 or 60. Azelnidipine appears to provide some freedom from so-called classical DHP side effects, namely ankle edema, tachycardia, proteinuria. And it appears to have effects on the kidney and the heart that I have shown you.
Good morning, dear my friends and colleagues. I'm Dr. Sepuri Krishna Mohan, endocrinologist and diabetologist, Kurnool. Today I want to say something about the novel dihydropyridine group of calcium channel blocker, the Azelnidipine. So now we talk about this particular Azelnidipine, which has got it is proven to be the cardioprotective, it is proven to be nephroprotective, it is proven to be cerebroprotective, it has got anti-atherosclerotic activities, it has got antioxidative actions, it has got it has got very good beneficial effects in reducing the proteinuria. The greatest advantage of the Azelnidipine is it reduces the insulin resistance. Thereby, it improves the insulin sensitivity, which is not only a favorable aspect with regards to hypertension, because Azelnidipine is a broad spectrum dihydropyridine calcium channel blockers with no reflex tachycardia, and has got a favorable effects on almost all the systems in the body. And dear my friends, I would like to conclude by saying that Azelnidipine is a newborn baby. It has got multiple pleiotropic type of actions. I cannot say it's pleiotropic like statins and all, but it is similar to that pleiotropic actions, which is to be used once a day. The available dosage is the therapeutic dosage is to start with it is 8 milligram, and to increment it to 16 milligram once a day. And in my setup, we have started conducting a trial on this particular Azelnidipine also. The Indian studies are going to start, and I am the principal investigator of that particular study which is going on this particular Azelnidipine, and we will see the results at the end of 12 months. And with all that, and in the COVID pandemic, I once again request and appeal all my fellow colleagues to take care of yourselves and your families, because we are in the front line of the COVID war. So now I just have to put on this mask. Humble namaste. Again, Dr. Sepuri Krishna Mohan, endocrinologist, diabetologist, and thank you so much. Thank you so much for patient listening.